This is the STL Medical Weight Loss Radio Show with Dr. Joe. No more talking, let's go.
Welcome back to the STL Medical Weight Loss Radio Show. I'm your host, Dr. Joseph Moleski. I have one of my good friends, producer Drew Shelton, with me today, and we're just talking about, we're talking about food, we're talking about sugar, we talked about the sugar audit, we talked about these meds, how they can be used as a tool to help guide improved habits, and just help us through this journey to reduce weight and get us feeling better and making us healthier from the inside out, and also regaining your confidence. So in the last segment, we talked about the liver and the rapidly increasing numbers of patients developing non-alcoholic fatty liver disease, where you have lots of sugar in your diet, your liver fills up with fat, and then you develop high blood pressure, diabetes, and you become sick. And you become insulin resistant. It's almost impossible to lose weight. You're trying everything to lose weight and you can't. That's what fatty liver disease, and 25% of the Americans in the American population has it. And this can actually get worse to where it causes almost like a hepatitis, irritates the liver, and you need a liver transplant. We're seeing that even happen in young children. And so, hepatitis C is a curable disease now. I mean, back then you had a lot of folks develop hepatitis C, and now there's meds for it, antivirals that reverse it. So one of the things that was really cool is there is a anesthesiologist that he mentioned this on his social media account, is that there's some preliminary trials and preliminary data that's coming out, is that patients that are taking semaglutide, tirzepatide, these medications that we prescribe, you're getting, and this is early data, this is not approved yet, this is just early data, and it's exciting that I want to share, is they're seeing that these medications are reversing people that have non-alcoholic steatohepatitis or non-alcoholic fatty liver disease. So these patients that previously, this, cause of liver disease, there was no medications for it. Really, the only thing you could do was diet, exercise, which patients struggle with that, and then they ended up having this fatty liver disease their whole life. It turned into hepatitis, and they might die of it. I've actually seen that in the hospital. And so now they're seeing the early data shows that this medication that we prescribe, it's starting to reverse that and kind of clean out their liver.
That's encouraging. For our future.
Yep. And if so many people are living with it, and now we have an option that reduces your weight, it helps your liver. I mean, I think it's incredible.
I would stand behind this 100%, and just knowing the results I've seen already.
Yep.
And when you're building a base or a brand and having testimonials, that helps too. I mean, I love these trials because, it speaks the result, and we need it.
Yeah, and I always say, in part of Dr. Lustig, he's a pediatric endocrinologist, that he's the guy that I look up to, but he always says, protect the liver, feed the gut. And when we say protect the liver, we want to make sure that, we're not consuming lots of sugar a day. We're going to make sure we stay away from the processed food, and we're going to make sure that we continue to eat, whole foods that are on the outskirts of the aisle, not the interior of the grocery store. Eating those leafy green vegetables, eating those colorful greens, eating meats that are organic, grass-fed. That's what we're trying to talk about. And the other thing I would like to get into is there's been a couple other things that Ozempic face, Ozempic fingers.
Oh boy.
Yeah. So Ozempic is the trade name for semaglutide. So we are a clinic that provides semaglutide, tirzepatide. The brand names are Ozempic, Wegovy for the semaglutide. Tirzepatide is Mounjaro. And so we do compounding, okay? So it's the active ingredient. We provide compounded meds that are compounded with B vitamins to help with the most common side effect, which is nausea. So these are compounded meds. What's great about it is the doses are readily available. They're shipped to your house. It's all telemedicine based, and the price is much lower than the name brands. So we pass that along to patients, and the reason I like the compounding drugs too is it makes it more accessible to clients. I mean, we're looking at about double the price. So if you're looking at semaglutide, tirzepatide, Mounjaro, Wegovy, if you want to get it from a pharmacy, you're like $1,300. and we have the price sheet on our website to just compare. So I noticed that when I started this, there was a lot of folks that wanted to do it, they couldn't afford it. And so then I was like, I'm not helping anybody. Like, I'm frustrating folks. Even I got patients the medication, like they were able to afford it, and they're like, oh, Dr. Moleski, I don't have the dose. Like, I can't get the dose. There's a shortage. So then I was thinking, well, wait a minute. Maybe I could just help the people that have the money to do it, and it'll be fine. Well, I did that, and then they couldn't get the dose. So I wasn't even helping them.
Wow.
And so the reason I do compounding is you're able to get the dose, there's no fuss, there's no shortages, and you're able to get a medication that is right for you, and it's consistent. I like the consistency, and you get consistent pricing.
Well, everyone's at a budget, right?
Yes.
And when you have, you can budget this out, and when you see the results, I don't want to waste my money on something that's not going to work.
Sure.
So knowing that I can trial this and that it works, I'm going to make sure I have that money set aside.
Yeah, and also, if you want to try it for a month, fine. But we always recommend, try it for a month, and then we, do 90-day scripts, so then you can keep on the trend. It's a dose dependent, so where, we start you at a low dose, 2.5, 5 milligrams, 7.5. We slowly increase the dose. We recommend it's, at minimum you try it for 90 days. And the other thing that I like to bring up is, I get back into the Ozempic hands and face. So Ozempic hands are, we're seeing that men and women, they lose a lot of weight, and they get, loose rings, or their hands become a little bit less swollen. And then your face kind of becomes a little bit, contoured more because you're losing weight in your face. And that can happen, sure. But, what about, like, the other benefits, like the Ozempic liver, the Ozempic joints, the Ozempic brain, the Ozempic heart, or semaglutide heart, semaglutide joint, liver, heart, or tirzepatide. You could put it any way, but like we're what we want to talk about on social media or some mainstream media outlets. We want to talk about all the bad things, and we want to talk about, there's shortages. There's a lot of information, folks, and it's sad because there's a lot of folks that actually need this, and they're getting misinformation out there, and then it's deterring them from starting something that could change their lives. And I wouldn't be doing this if I wasn't so passionate, and I've seen the results. I've seen people lose 70 to 90 pounds on this. Granted, it takes a year or so, but I've seen people change their life, and they're coming to me in tears and saying, if I did not do this, I don't know what I would do. I don't know what I would have done. I'm tired of being on medicines, and I've had so many patients talk to me about mental health. Like, this has changed my life, not only physically, but mentally.
I mean, this is airing here June 24th, June 25th weekend, and I've been on it since April 18th. And what I've seen in 2.5 months is so eye-opening that I just want more and more people to try. That's all you can do is try. Maybe it's not going to work for you. Sure. But, I've seen enough people here at the station, I've had enough listeners tell you, hey, it's working for me, it's going to work for you too. You just have to have the right mindset. Yeah,
have an open mind. And realize, like, you're not alone. There's a lot of patients that I have that are on this. In the future, we're gonna have an app. We're gonna do big things. I want to make sure that all my patients are connected, and we're gonna have an app to where everybody can join a community and talk. So I've been doing this for about 16 months, and I'm not gonna stop, because I know that the path to success for a lot of patients is just they need their hand held a little bit. They need time, they need education, and they need trust. Respond to them. They need somebody that actually cares about them, and that's me, and that's my team. One of my partners, Marguerite Walsh, she's a PA that works with me, and she is over the moon, one of the best providers I've ever worked with. And she makes sure that the same quality that I provide goes out to our patients. And I'm just letting you know, we care, and you can trust us with your health and your family, and we're gonna make sure that you're happy, and we're gonna make sure that you get the results you want, and you're confident. And that's what I want to. I think that's my biggest goal, is to regain your confidence, make you feel like you're heard, and make sure that whatever medication it may be, semaglutide, tirzepatide, or other peptides. Or maybe you just need some education and some labs, and you just need some talking to. We are happy to help.
And it's an easy process.
Yes, it's an easy process. If you want to get started today, You can easily book an appointment. That's the best way to get started at stlmedweightloss.com, or give us a call at 636-628-6604 for more info. Folks, I hope to see you soon. I hope to talk to you all soon, and there's a lot more to come. And look out for my podcast. It's going to be airing soon on Apple Podcasts, STL Med Weight Loss. And if you have any questions, please, we're always a phone call away. And don't be scared to just say, I want to invest in me.